Hi, Namaste to all. Welcome to Hum Tum discussion. Today our topic of discussion is dysthymic disorder, coded as 6A72 by the ICD-11. Some of the essential features for its diagnosis include: first is the persistent depressed mood lasting for most of the day, and it lasts for more days than not. That means it is happening more than half the time but not every single day. The persistent depressed mood would be chronic but milder than the depression, and it may be reported by the individual or may be observed by somebody else. And manifestation include, if reported by the individuals, are feeling down or sad, and if somebody else is observing, tearfulness or defeated appearance would be there. For its diagnosis, time duration will be 2 years or more in adult and 1 year in children and adolescents. Symptom-free period does not exceed 2 months period. Some additional symptoms typically seen in depressive episode, though these may be milder in form, include: first is markedly diminished interest or pleasure in activities. Second is reduced concentration and attention or indecisiveness. Next is low self-worth or excessive guilt or inappropriate guilt. Next is hopelessness about the future. Next is disturbed sleep or increased sleep. Next is diminished or increased appetite. And last but not the least is low energy or fatigue. So out of these, at least 2 should be there. During the first 2 years of the disorder, there has never been a 2-week period during which the number and duration of symptoms were sufficient to meet the diagnostic requirement for depressive episode. And next should be, there is no history of manic episode, mixed episode or hypomanic episode, which would indicate the presence of bipolar disorder. Symptoms are not better explained by another mental, behavioral or neurodevelopmental disorders. And symptoms are not due to the direct effect of a substance or medication on the central nervous system, including withdrawal effect also, or any type of medication. These symptoms result in significant distress or impairment in social, occupational and other important area of functioning, that is maybe personal, family, educational, etc. And individual with a family history of mood disorder having a higher risk of developing dysthymic disorder. Co-occurrence with other mental disorder is very common, and it include anxiety and fear related disorder, bodily distress disorder, obsessive compulsive disorder, oppositional defiant disorder, disorder due to substance use, feeding and eating disorders, and personality disorder. Suicidal risk is significantly higher among individuals diagnosed with dysthymic disorder than general population. Now we will see the developmental presentations. Okay. In young children, dysthymic disorder may be presented as somatic complaints, for example, headache, stomach pain, weaning, increased anxiety or fearfulness, or excessive crying. In adolescent with dysthymic disorder may demonstrate low self-esteem or perceived negative feedback from others. Children and adolescents may present with depressed mood, and it is equivalent to pervasive irritability. So they are showing pervasive irritability instead of depressed mood. And decline in academic performance, increased time needed to complete school assignment, or an inability to complete the assignment. Thank you. If you have any doubt, you can ask in the comment box.